My name is Chelsea Russ, and I'll be presenting my integrative review on exercise and preeclampsia. Preeclampsia is a major health concern for women worldwide. It is a leading cause of maternal and perinatal morbidity and mortality. The cause is unknown and incidence is growing. Preeclampsia is diagnosed when the patient of 20 weeks greater of gestation experiences increased blood pressure along with proteinuria, thrombocytopenia, renal insufficiency, impaired liver function, pulmonary edema, and/or cerebral or visual symptoms. The first study I evaluated was a prospective cohort that examined the relationship between physical activity in the early stages of pregnancy and the risk of preeclampsia. There was no statistical significance between preeclampsia and physical activity. The next study was a randomized controlled trial performed to examine the association between physical exercise in pregnant women with chronic hypertension and/or previous preeclampsia and maternal and neonatal outcomes. The result of the study indicated that physical exercise in these high-risk pregnancies did not lead to an increased risk of preeclampsia. It also did not suggest that exercise has a protective factor against preeclampsia or hypertensive disorders. The third study being evaluated was a prospective cohort that examined the relationship between physical activity in early pregnancy and the risk of developing hypertensive disorders and preeclampsia in pregnancy. Women with high overall activity levels were 80% less likely to be diagnosed with preeclampsia compared to those with low levels. There was also a statistically significant decline in risk of hypertensive disorders as sports and exercise activity levels increased in early pregnancy. The next study was a population-based cross-sectional survey that investigated the association between physical activity prior to and in the last 3 months of pregnancy and hypertensive disorders of pregnancy. The study found that women had their risk for hypertensive complications decrease as their activity level increased. Pre-pregnancy exercise did not have a significant effect on the risk of hypertension. However, women who exercised more than once per week during the last 3 months of pregnancy had a decreased risk of developing hypertensive disorders in their pregnancy compared to those who exercised less than once per week. This protective effect increased with the activity level. The last study was a prospective analysis that assessed physical activity before and during pregnancy and the risk of preeclampsia. Data indicated that any recreational activity during the year before pregnancy reduced the odds of preeclampsia. However, physical activity during a week in early pregnancy was not associated with preeclampsia in any significant way. Overall, there appeared to be some clinically significant data. Exercise in pregnancy did not seem to increase the risk for preeclampsia, and in many cases actually decreased the likelihood when active prior to and/or during the pregnancy. Advanced practice nurses have the obligation to educate their patients on ways to reduce their risk for preeclampsia. This is imperative for those working with women of childbearing age in any setting, and in obstetrician offices and those working with pregnant women in particular. Pregnancy is a vulnerable time for many women, and they rely on their healthcare providers to guide them towards the healthiest pregnancy possible. Advanced practice nurses can instruct them on how to stay physically active for their health. It's also important for those in perinatal care settings to assist pregnant women in staying active to decrease the risk for complications. Thank you.